Okay, so before I would walk into the room, I would knock on the door just to make my presence known. I would wash my hands and introduce myself. Hi, my name is Abby. I'm going to be the student nurse today taking care of you. I have orders to insert a indwelling catheter. Can you please confirm your name and date of birth? She would tell me their name and date of birth. I would check it against their wristband. I would ask them if they have any allergies to latex, shellfish, anything like that. They would say no. I would also have the curtain pulled just for privacy reasons. And I would explain to them that we're going to insert a catheter. Should take no more than 10 minutes or so. So as I proceed, I have my sterile kit here. I first would open my sterile kit. I had this, the bag here for my trash. So I will leave that over on here. And then as I open my sterile kit, my patient would be in the lithotomy position so I can have access to her urethra and just have all areas to see instead of her being supine. So I would go ahead and start by opening my sterile kit. I have a drape in here. I would want to drape this over my patient and just expose the area that I'm working with. And then I can get my sterile gloves out. And I can place that on my sterile field. Would normally have a bigger table to work with. So as I open my sterile gloves, again, if my sterile gloves would rip, I would replace them with a new pair of sterile gloves. Now that I'm sterile, I can touch my field. So I have another drape in here. And I would drape this under the patient just in case if any urine comes out, it would be able to keep their bedding clean. So I have my betadine. In the trash. I would soak all the cotton balls with my betadine. And I would throw that in the trash. I have my tweezers. So I would just take one at a time, use my non-dominant hand and open up the labia. And just take top to bottom one swipe, trash, another cotton ball, trash, up to down, trash. And I would do the same process, top to bottom, until I am done with all of my betadine swabs. This also comes with the lubricant. So I would open up the lubricant and squirt it into my tray. That's done. So now I can go ahead and get my catheter out. So I would go ahead and take my sterile water insert it And then I would use my non-dominant hand to spread the labia. I would get the tip of the catheter well lubricated, spread the labia, and then slowly fish that into the urethra. When I notice that there is urine in my tube, I would go ahead and inflate the balloon in there by pressing my saline in through the syringe. My straw for my urethra is really tiny, and it is not letting me push a whole lot of anything in there. But once I have the catheter placed, I would put the tubing on the patient's leg with a strap, and then I would hang this off of the bed with the designated clip. When I'm coming to take out the catheter, I would again use a syringe at the tip and then pull back any saline that is in there to release the pressure of the balloon. Again, I would pull the labia open and pull it out with my dominant hand. I would make sure that the patient has a lot of privacy. Try not to expose her as much, but I would also make sure that her area is sterile as I'm placing it. After, I would ask her if she's comfortable, feels okay, having any pain or anything like that. And then just thank her for her time. And if she has any questions, that she could go ahead and just use the call light or ask one of the nurses whenever they come in. I would thank her for her time, keep the curtain pulled, and then leave the room.